Should a surgical medical practitioner with HIV positive be continue his or her professional practice? A surgical doctor, Dr. X, committed suicide last year. The newspaper popularized Dr. X commit suicide as contracting AIDS. To release the public's concern, HA announced the case to the public and invited 143 patients for HIV tests. Fortunately, no patient was infected. Initially, HA does not disclose because it was Dr. X's privacy and it was very low risk of HIV transmission to the patient through the operations. Is it a right time and need for disclosure of Dr. X's personal information? Also, the more important one is that should a surgical medical practitioner with HIV positive be continuous his professional practice? Why HA disclosed lately? Because it is the problem related to confidentiality and discrimination. In ethical view, as the employer and employee relationship, hospitals need to keep it confidential. In legal aspect, it doesn't match any one of four relaxations to break confidentiality. Also, based on prevention and control of disease audience, HIV is excluded in law as an infection disease. HA should not disclose without Dr. X's consent, otherwise HA breaks the law of confidentiality. Disclosing may lead to indirect discrimination because DDO has included HIV infection as a disability. If disclosing the diagnosis of HIV positive to the public, Dr. X and his family will probably face social rejection and discrimination based on other people's and society's reaction to HIV. If the information disclosure is only applied to Dr. X but not for other people, it can treat as indirect discrimination. Therefore, it is not necessary to disclose. Why HA disclosed finally? It is because of the press freedom and the public interest. According to the basic law, Hong Kong residents should have freedom of speech, of press, and of publication. However, the press freedom needs to restrict if it have conflict between the personal privacy. In the case of X and Y, the newspaper was prohibited by HA to popularize the information about two doctors were being treated for AIDS. So, the newspaper supposed not allowed to disclose the information. However, they disclosed. Public interest is also one of the justifications to break the confidentiality. In this situation, the public are gradually give pressure to HA. If the public interest in disclosure outweighs that of non-disclosure, it will be served by disclosure. Therefore, Dr. X's details are disclosed in the right time due to the public interest. So, how a HIV positive be continue his or her professional practice? First, the public may concern about the transmission rate of HIV. However, it's only 0.12%, even lower than HPV. On the other hand, will the issue ethically, the doctor should put the patient's right as the first priority. Based on the biomedical model, in respect for autonomy, Dr. A should inform his patient and respect their decision. In beneficence, we should consider the balancing of benefits and risks of receiving the treatment from Dr. X. For non-maleficence, it means that Dr. X should avoid all of the causation harm to the patient. Although there is no any restriction for the infected practitioner, however, they should have their own ethical preparation in order to save the life of their patient as well as preventing infecting them. According to the medical council, if the doctor have health problem, no matter physical or mental, if it will put the patient at risk, they should totally or partially withhold their practice and seek for the treatment. So, the infected practitioner should immediately undergo treatment properly. Moreover, HA should build up a trust relationship with their employee in order to encourage their employee to report their case voluntarily. However, if the infected practitioner do not comply to the medical regimen, which may cause the patient at risk, the doctor should immediately report to the court and take legal action. On the other hand, under the utilitarianism, which promotes the best outcome, although he may have a chance to infect the patient, he can rescue more than 100 patients by doing the operation. At the same time, due to the nature of the relationship between doctor and the patient, Dr. X do have a duty to promote the benefits which cure the patient. For the suggestion, the public education is very important to correct the misconception of HIV. To educate our citizens, HA can keep reporting the summary of updated HIV situation and educate the transmission method of HIV to allow people becoming open-minded and friendly about the AIDS patient. Besides, the publication style should be correct too. The information disclosure should be made only to those who is necessary to tell. HA should only contact to the patient who is treated by Dr. X rather than the public. In conclusion, HA should not report the condition of Dr. X because of the confidentiality of Dr. X and discrimination, and should individually report to the affected patients. Moreover, a surgical medical practitioner with HIV positive can continue his professional practice when he seeks for the medical treatment and has to follow up regularly.